Cervical cancer is the leading cause of cancer deaths in Kenya. And our goal is to eliminate cancer deaths due to HPV. My name is Dr. Vincent Kioi, a specialist in vaccine development, and today we'll be speaking about HPV, the human papilloma virus, how we can use vaccination and other measures to prevent infection, and the measures we can take to prevent cancer deaths as a result of this virus in Kenya. HPV stands for human papilloma virus. This is a virus that infects skin and surfaces on the human body. How is this virus transmitted? It's primarily transmitted through close contact, mainly during sexual intercourse. However, unlike most sexually transmitted diseases, you do not need to have penetrative sex to transmit HPV. Close contact between skin surfaces is enough to allow for transmission of the virus. When thinking about whether one needs to be able to look out for an infection in their partner, it's important to note that most people who are living with HPV do not have any symptoms. There's no sign or symptom on the skin that can point towards the presence of this virus. Why is HPV important? HPV is one of the main causes of several cancers that affect the human body. In Kenya, one of the leading types of cancer is cervical cancer. Almost all cases of cervical cancer are caused by HPV, and this accounts for more than 5,500 cases every year in Kenya alone, and is the leading cause of cancer deaths in Kenya, with more than 3,500 women losing their lives. The virus is also responsible for causing other types of cancers, mainly in the throat and in the anus, and is able to affect both men and women when discussing these types of cancers. Most people will be exposed to this virus in their lifetime. There are over 200 types of these viruses, and around 14 of them are able to cause cancer if they cause infection in the human body. It's important to create awareness around how common this infection is, because with awareness, we are able to enable individuals to seek out preventive measures and protect themselves from late-stage cancers that could endanger their lives. When thinking about cervical cancer, we have both primary and secondary prevention. The primary prevention of cervical cancer is mainly through the use of the HPV vaccine. This vaccine is available in Kenya for all children above the age of 10 and is best administered for girls between the age of 10 and 15 years, when it's able to have the best effect in protecting them against HPV that could lead to cervical cancer. At the moment, the government has a national program for a vaccine that's able to prevent 4 types of HPV. 2 of the types contained in the vaccine prevent cancer, while 2 of the types prevent another disease caused by the virus called warts, and these can appear in the genital region or other parts of the skin. Vaccination at a young age with a single dose of this vaccine is able to prevent most cases of cancer. For those who do not benefit from vaccination, there is what we would refer to as secondary prevention. Secondary prevention is mainly through the use of screening tools that allow for early detection of precancerous lesions before they cause advanced disease that could jeopardize an individual's life. This secondary prevention can be done with simple tests that are able to detect the presence of the virus and allow for doctors to intervene by removing any lesions that have developed before they cause what we refer to as invasive cancers. Cervical cancer is the leading cause of cancer deaths in Kenya. And our goal in using primary and secondary prevention measures is to eliminate cancer deaths due to HPV. When thinking about the number of lives lost every year, should we be successful in implementing the national programs around HPV prevention and the prevention of cervical cancer, you could imagine that over a 10-year period, we would have benefited the lives of more than 35,000 women by preventing premature death. At the moment, the government has national programs and recommendations for both the use of the vaccine in girls between the age of 10 and 15, as well as for screening of all women who are sexually active. And with the implementation of these programs, we do give ourselves a chance for elimination of cervical cancer deaths in Kenya.